Okay, hi everybody. Welcome. Good to see you all. And I am going to present work that I had nothing to do with, but it's going to be pretty great. So I'm Ari Berman. I am. I'm guessing this will come up. I am the Chief Science Officer at Starfish, and I think a lot of you who do know me from BioTeam for lots and lots of years. But it's fun to be on a new journey with Starfish, and I'm going to tell you this really cool story once it comes up about a project that we did with one of our customers, Arizona State University, and what essentially great data management can do for science. It's coming, I guess. Well, I'll start with the the only part of this talk that is salesy at all, which is just what the heck is Starfish, because I think a lot of people either know or don't know, and so where we are at the core is there we go. Except that now I can't see it here. What we are at the core is a data management platform that can be used for a whole bunch of different things, and so I'll come back to that since this is here. So as Chris said, known Chris a lot of years, good to see you. We're talking about how Arizona State used their instance of Starfish along with some of our staff to make a 25-year longitudinal study of indigenous data more readily available for researchers to use. And so that's what this is about. All right, so here's the ad. We're basically a versatile and scalable file management platform. So we deal entirely with unstructured data files. If you have files, who has files? I think everyone has files. We're one of the ways to really handle extant distribution of data across a whole lot of storage systems or areas or whatever. And so what we are at the core is a data catalog that catalogs all of your files across any of your file systems, which makes it so that you can actually search your data and analyze it and figure out what it is you have, since file systems inherently suck at that. People end up losing a lot of their data, not really knowing where it is. Organizations end up losing a lot of data, and so by doing that, you can really identify, what you have, old stuff, stuff from people that aren't there anymore, orphan data, and utilize our platform to do something with it. You can archive it, you can delete old data, you can move data into research-related collections, you can optimize what you have. And one of the things that we really have built the platform for is scale. And so our largest customer is nearly an exabyte with many tens of billions of files on several file systems. And we work between pretty much any file system out there, including cloud targets, S3, those sorts of things. And so what this will highlight today is a really creative way to use a system like ours. Our system is very flexible, which is both the best and the worst part of it. It means it's complex also, but we have amazing support. So that's the end of the ad. So here is the project. With Arizona State, they've been a part of the Tsimane Health and Life History Project for a long time, and it's essentially a 25-year longitudinal study of healthy aging in an indigenous Bolivian community. And they have one of the lowest levels of coronary artery disease ever recorded, and their brains appear to age way more slowly than most industrialized nations. And so basically what they did is using a local hospital in Trinidad, whole body CT scans of these folks, right? And if you've ever looked at CT scans or anything like that, the output is a DICOM image, which has a bunch of metadata attached to it inside of it, and it's a very standard type of data. It can add up as well. And so they also collected demographic, genetic, biochemical, and medical imaging data. And then the research that is using those data are across cardiovascular disease, Alzheimer's, aging, other brain-related diseases. And so it's sort of a unique window. And just in case you have no idea where Bolivia is, there's the map in South America. So, all right, so how this worked before, sort of the standard, which I'll say the hard way, because we life scientists love to do everything really hard. I will say with data, we tend to do things in a non-optimized way, I think because we're crazy and stubborn, but here we are. The CT scans were captured, they were copied to hard drives. Those hard drives were physically mailed, transported, and the data dumped onto a central system, and those data were manually curated when a request was made. And so basically a researcher said, I want this data, this group of data set from these, and a person had to go in and manually assemble the data and then make it available to that researcher. The wait list was quite long, and so the researchers from that request waited weeks or months to get access to it. And so you can imagine that that's not really the most effective way to do things. And because it was a 25-year study, there was inconsistent metadata across all the different scanners and the different resolutions that were used over time, the technicians who captured it, and there was no central catalog, and everything required sort of manual sorting. And so, specific queries included things like all high-quality lung scans, males over 50, right? It was pretty impossible to work out. So, this was more than just a storage problem. It was first and foremost a data governance problem, because every image, being human and potentially identifiable, required a unique consent trail, and the access was restricted and must be fully auditable. This is not unusual, I think, to most people in this room. Because of the requirements, they couldn't use cloud, so it had to be on Arizona state-controlled infrastructure. So cloud services like S3 couldn't be used. Messy metadata, I don't think I'll elaborate that again. And then privacy requirements, the data sets had to be both de-identified and fully anonymized, and relinkable back to the original person in case consent changed over time. Our collaborator and client at Arizona State, Sohail Ghafoor, IT manager for the Center of Evolution and Medicine, joined the Tsimane project in 2022, inherited this giant problem, essentially, and he specializes in open source data management. He wishes he could be here, by the way, but couldn't make it, and computational pipelines and petabyte scale infrastructure, and he manages a lot of NIH-funded projects spanning genomics, medical imaging, and population health. And so his quote here, which is obviously self-serving, but I think it's fun, is the collaboration between ASU and Starfish transformed a fragmented DICOM repository into a structured metadata-driven resource tailored for research needs. So what did that look like? His vision was to figure out a way to give the researchers a self-service searchable system so they could find exactly what they need without the need to wait in a queue for someone to figure it out. And so these researchers needed something familiar, something that they can use, like directory structures or trees that they're used to browsing through. You can find things by body part, scan quality, reconstruction type, those sorts of things. But the data had to stay local and it had to stay compliant. And it kind of had to be self-sustaining in order for this to move forward. And so why could Starfish help with this? It's because, we can ingest file level metadata on 80 or 90 different file types, and so we can crack open the file and pull that into the data catalog, and you can search by it. We have a pretty extensive custom tagging and enrichment system you can use, so they could add domain-specific metadata fields, and you can query on metadata and automate based on that. We had the ability through scripting in our API to create essentially symlink directory views so that the data didn't have to move or copy or anything. It was just linked out so they could have access. And then it was on-premises deployment because we're not a SaaS product, and so that remained compliant. And we scale quite a lot, and so it was a relatively easy thing for our system to do. And so here's where we eliminated the hard drive handoff. And so essentially the data transfer pipeline is queried the PACS system, downloaded the scans, validate the files, extract the metadata, compress them, and then transfer them to ASU, right? Instead of the shipping of hard drives and working through that. And so the implementation details were that I think Suhail wrote scripts using a Postgres job to coordinate the entire pipeline. That pipeline run automatically, replacing months of physical logistics. And I don't know if you've ever shipped hard drives to yourself or had someone ship a hard drive to you and you plug it into a computer and try to do something with it. It is not okay. It is slow, it is hard, and it doesn't always work. And so this created a repeatable digital workflow. The scripts were all open sourced, so they're out there on GitHub for folks who are facing similar challenges, which is pretty cool. The database acts as the job queue, and each step for pending tasks and passes work to the next stage. So one of the real challenges next was to make 20 years of data speak the same language. Right? So raw DICOM metadata had a whole bunch of different things, body parts in 3 different fields, but depending on technician. I think they were in different languages also. Scanner position, values used to infer anatomy, quality mixed, collaboration. There was mixed quality essentially, collaboration plus research scans together, and multiple reconstruction passes. And basically, Suhail came up with this translation to say, okay, here's the body parts, which organ, which was auto-detected via the JSON lookup, what was the quality, and whether it was a calibration image or it was a high-quality image, and what was the recon type, so bone, soft tissue, organ, those sorts of things. And so using the metadata, we're able to sort of pull that together and loading it into Starfish. And so the Python script extracted the metadata, all that information from the files. It auto-detected the organ type. It handled the different privacy modes, which were also embedded, and imported all those information into Starfish using key value tags, and making every DICOM file queryable across all those attributes. And so there were essentially 2 different structures that were represented after this, right? So the researcher experience, there's a quality assurance view, which basically was per patient, and so you could go in by anonymized patient and look at, okay, so this is the head brain, high quality head brain calibration and the dosage report, et cetera. Or you could go in this was the local one that they used to make sure everything was okay. But the researcher view broke it down by several things like DICOM by body parts. So you could go in and look at lung high quality images or calibration images or brain high quality images. And then it would list out the patient scans, individual scans, and those weren't copies. They were linked back. They were linked back to the quality assurance view. So that meant that there was 0 copy. It didn't take up more space, and it was easy to browse. And so essentially what this did is it took months of waiting down to minutes of self-service fulfillment requests, and the researchers could work independently. They could browse the data, they could analyze it. There was no manual curation or waiting. The full data governance was preserved, so everything was traceable, compliant, with consent agreements, and it was reproducible. Sustainable and maintainable. For ASU, this is something that you could just do, and it gave a whole lot more access to researchers to look at their various longevity studies and compare their patients with this unique population in Bolivia. And so it was a replicable model, for research imaging data, automate the transfer, normalize the metadata across 25 years. It's not the easiest thing to do if anyone's tried to do that. And, import it into Starfish and then, build the researcher-ready views. So it's essentially the presentation layer just made everything a whole lot easier for everybody and made it more accessible. And so the people that were involved in this, I already mentioned Suhail Ghafoor, and then on our side, Matt Hutchinson, who's over there, who helped with all of this and helped to write scripts on our side and make Starfish do what Suhail's vision was. And Daniel Cummings from Chapman University was the CT scanning system architect from there. And so with that, that's the story. It was really cool. We liked it a lot. Those scripts from ASU are in a GitHub. We have this full white paper on our website, starfishstorage.com, if you want to learn more and look at the GitHub. And we are very honored to be awarded this award from BioIT World. So with that, I will stop.